Hello and welcome. So from today I'm going to talk about our eye anatomy in details. This eye anatomy is very important for your theory purpose, viva purpose, practical purpose and MCQ based exam purpose. Also it is important for you in third year MBBS ophthalmology subject. Okay. Now this eye presents in our orbital cavity, as you can see in this photo. This orbital cavity is a bony structure and in shortcut we call it orbit. So this orbit consists of our eye or eyeball associated with our orbital muscles, orbital ligaments, then its blood supply, nerve supply, lymphatic supply, along with it lacrimal apparatus and pad of fat. All these structures I will talk about slowly, one by one. First of all, orbit, as you can see in this photo. It's a four-wall shaped pyramidal structure and the apex is directed towards the optic canal. You know already about optic canal, as I told you in my earlier videos. Boundary of this orbit, as I said, it has four walls. So basically, common sense, you're gonna find the roof. Suppose this is the roof, okay? So it has anterior segment, posterior segment. The anterior segment of the roof is formed by the frontal bone. I mean the orbital surface of the frontal bone, and the posterior part or the posteriorly you're going to find the lesser wing of sphenoid. That's it. And the floor is formed by the orbital surface of the maxilla bone. And anterolaterally you're going to find the zygomatic bone, and posteromedially you're going to find the palatine bone. Okay? Lateral wall is present or the formed by the anteriorly zygomatic bone, and little bit posteriorly you're going to find the greater wings of sphenoid. And lastly, the medial wall is formed by this there towards the central axis of the body. The medial wall is formed by the frontal process of maxilla, lacrimal bone, orbital plate of ethmoid and the body of sphenoid. That's it. Now you have to understand the relation or the surrounding structures of this orbit, I mean the orbital cavity. First of all, superiorly you're going to find anterior cranial fossa and the frontal sinus. Inferiorly you're going to find the maxillary sinus. Laterally you're going to find the zygomatic bone, temporal fossa and the middle cranial fossa partially. And in the middle you're going to find ethmoidal sinus and sphenoid sinus. Okay, so I will talk about all this sinus in later ENT part, not here. So from my next video I will talk about in details about our eye, all the parts. See you in my next video. Till then, bye.